I want to start today by thanking the millions of people throughout the province who are doing what they need to do to get us through this pandemic. I know it has been a most challenging time, and we had lots of optimism, and we are now in a place where we need to take additional measures. And I know most people in this province are doing their part. And I also want to thank our healthcare workers across the spectrum in the province that go to work every single day to do the best they can to care for us as a population and individual patients, whether that's in an acute care facility, in our ICUs, the healthcare workers that are greeting you at the door, our paramedics, our public health teams that I talk to every single day. My colleagues across the province are stepping up even after 20 months of this, and even when they're tired, to make sure that we're doing the best we can to care for people across the province. You have faced and continue to face an incredible amount of pressure and stress, and I am incredibly grateful. And I want everybody to know that your efforts are gratefully felt by the vast majority of us here in BC. We stand with you and are supporting you in everything that we can do. Today is a couple of things today. One is our BC vaccine card comes into effect today. This means that we'll be able to do more of the things that we love, that much more safely, knowing everybody else in that situation is vaccinated as well. My hope is that in the weeks ahead, we'll be able to remove things like capacity limits and other restrictions because of the protection that we have, knowing that vaccinated people are in these settings. I'm pleased to see that over 1 million people across the province now have downloaded their card or have it coming to them in the mail. Thank you for your continued commitment to doing your part to keeping our province safe and to keeping those important functions open, those jobs going. If you have not yet taken the steps to get your vaccine card, it only takes a few minutes. And for these next couple of days, as everyone gets used to the system, please be patient. We're in this together, and we'll get through this. We'll get over the bumps over the next little while. To those of you who have not yet been vaccinated, clinics are open every day. And if you have concerns, connect with your doctor, talk to your pharmacist, get the information that you need to make the right choice to protect yourself and your community. I'm also happy to say that the vaccine card now means that the orders that were in place in interior health, restrictions on gatherings, restrictions on some operations of some businesses, will now be revised to allow for exemptions to the restrictions for these businesses and events that use the BC vaccine card to ensure attendees are fully vaccinated. That extra layer of protection means that we can now start going back to those activities in the interior health that had been restricted over the last little while as cases increased. Also today, in addition to the vaccine cards coming into effect, we're making 2 additional changes in our pandemic response. Late last week, many people would know, the National Advisory Committee on Immunization announced their recommendations for a 3rd dose for a group of people who are severely immune compromised. And in alignment with these recommendations, we will now be providing a 3rd dose to that group of people. For the vast majority of people, a 3rd dose is what we would call a booster shot. It means it would increase our response and prolong our response. But for people who are immune compromised, it's a different story. As a result of their medical conditions, people who are immune compromised don't respond as well to any vaccine and have a reduced ability to fight infection. This means that they may not have responded adequately to the first 2 doses and given them sufficient antibodies that they would be protected. And this puts them at much higher risk than most of us. For these people, a 3rd dose is needed to give enough protection that most of us would get after our primary series of 2 doses. So for these people that have less protection from 2 doses than the rest of the population, the 3rd dose completes that primary series. Here in BC, we have identified and prioritized a group of about 300,000 people who have medical conditions that make them clinically extremely vulnerable to COVID-19, our CEV group. And these are the people that we prioritized early on, along with other high-risk people by age, to receive their vaccine series. Part of this group, a subset of this group, are people who are severely immune compromised. This is about 15,000 people, and these are the people who will be receiving an invitation this week to receive a third dose starting today to complete their primary series. And the group of people we're talking about are people who've had solid organ transplants, people who are being actively treated for hematologic cancers and lymphoma, people who've taken anti-CD20 medications or B-cell depleting agents. These are medications that cause suppression of an immune system since January of 2020. People with severe primary immunodeficiencies. So these are some conditions that people are born with that means that their immune system doesn't respond as well, particularly the cell-mediated immunity like your T cells and your B cells. And people who've had a bone marrow or stem cell transplant. So this group of people, you will be receiving a text or an email from IMSBC. We know who you are because you've received your CEV cards and you've received your vaccine doses. And you will be receiving a notice this week to be able to go in to any clinic in BC and get your third dose. The studies that show that many people in this group get no or very few antibodies even after 2 doses of vaccine, and a third dose can stimulate a moderate response in as many as half. What does this mean? This means that even though you have 3 doses of vaccine, it is still important for people who have severe immune compromising conditions to continue to take precautions to avoid exposure. And it reminds us, again, that there are some people who cannot get as much protection from these vaccines, and it's that much more important that all of us around them are protected to keep them safe as well. As part of our clinical extremely vulnerable group, there are also a second group of people, about 120,000 people in BC, who are moderately immunocompromised, who are also identified by NACI as people who might need a third dose as well to complete their primary series. Here in BC, we are looking at these data, and we'll be our BC Immunization Committee will be reviewing this with the clinical experts that have developed the CEV program, and we'll be providing an update for those individuals once we have a better understanding of these risks, and that's likely to be later in September or early October. If you did not receive an invitation, you do not need a third dose at this time. It really is limited right now to those about 15,000 people that we know are severely immunocompromised. But rest assured, we are looking at that information and we'll be getting in touch with people soon. The third group of people in our CEV group is the majority, and those are people who have a strong immune response. We know that they have a condition that made them more susceptible to having severe illness from COVID-19, but that their immune systems respond as well as everybody else's to the 2 doses of vaccine. If you haven't had your second dose, now is the time to do that, and we will be monitoring the vaccine effectiveness as we are for everybody over the next few months. And if a third dose is required, a true booster dose, then we will be prioritizing everybody in the clinically extremely vulnerable group again to make sure that you get your third dose soon. The third thing that we're talking about today, as we've done with people who work in long-term care, we're also making changes to the vaccine requirements for all healthcare workers who work in acute and community care across the province. We'll be implementing a new order that makes vaccination against COVID-19 a condition of employment across all healthcare facilities in British Columbia. This includes all people, all workers, students, physicians, residents, contractors, and volunteers who work in a healthcare facility, including contracted facilities, which are accessible to patients and where they receive services. So it also includes people who work in settings such as home and community care locations, including clients' homes. This order will come into effect on October 26. I recognize that there are some rare instances where people may have a medical condition that prevents them from being fully vaccinated, and we will have a process in place through my office with a committee of experts provincially to review every individual request for a medical or religious exemption. And the details of that will be coming out very soon. I recognize that for some people the vaccine card is difficult or something that they have challenges with. And I'm very disheartened to see, however, that some people find that it's okay to take out this frustration on healthcare workers. Our healthcare workers across BC are day in and day out providing the care we need in sometimes extremely stressful situations. And they continue to care for people no matter what their vaccination status is, whether you have COVID-19 or whether you have any other illness in this province. But I know from talking to my friends and colleagues, we are tired and stretched from this pandemic, and we are all working tirelessly regardless of that. We must all come together to show our respect and caring for the healthcare workers who have supported us over this last year and a half. That means being patient. It means being respectful when you are asked to wait before entering a healthcare facility or asked to come at a specific time. It's making sure you continue to wear a mask in all healthcare settings. That is still the rule. That is still required in all healthcare settings across this province because we know that those are higher risk settings and it's a setting where people are more vulnerable to getting COVID-19. These rules are in place to protect all of us, patients and healthcare workers alike, and we need to respect them. Our hospitals are strained right now, and they're strained with the added burden is being felt across the province. Our emergency departments, our ICUs are filling up, not just with patients who have COVID, most of whom have not yet been vaccinated. But it also means an impact on others in our community who aren't able to get the surgeries they need, who have to wait longer to get the services they need. Sadly, choices not to get vaccinated is affecting our families and our communities across the province. Our healthcare workers deserve better, and so do we, all of us in British Columbia. It is our shared responsibility to get through this next phase of the pandemic, and the best way that we can reduce our risks individually as a person and to those we are closest to and to our community, and to improve the safety of everybody and get back to the things that we need to do is to get vaccinated. We need to have as many people as possible with as maximum protection as possible so we can get as much open as possible and get back to doing the things that we need and love. And that's one of the tools that we have is the vaccine card to help us do that.